Where do you see whorled pattern of smooth muscle cells, bundles?
Leiomyoma.
Leiomyoma, more commonly
Yeah.
seen in which ethnic group?
African.
African American. Which
African
American.
cancer is more common in African American?
Third question.
Which breast cancer more common in African American? Has poor prognosis. Which one?
That
No.
Oh, it's wrong answer.
Very
Triple negative.
Yes, negative. Yeah.
Triple negative type of breast cancer has poor prognosis, and that is more commonly seen in African American. Which particular type of melanoma is more common in African Americans?
Acral lentiginous.
Acral lentiginous.
Acral lentiginous.
Which granulomatous is more common in African Americans?
Sarcoidosis.
Sarcoidosis. Which particular hematological disease is more common in African Americans?
Sickle.
Sickle cell.
Sickle cell.
Disease. Anything else?
Thalassemia.
Trans, alpha thalassemia, trans, cystic Asians, trans
Yeah, this is
Africans. Sickle cell disease, we discussed about this. I told you last time, transition from glutamic acid to
Valine.
valine. What about vitamin C disease?
Lysine.
Lysine. The severity in a melanoma will be decided on the basis of deepness called as Maslow's thickness.
Yeah, let's go.
Which one has a poor prognosis, vertical or horizontal?
Vertical.
Vertical. Which variant is the one that is vertical having poor prognosis? Nodular type. Nodular type. The one that has a good prognosis is easily visible superficially, so called as superficial spreading type. Superficial spreading type, isn't it? Squamous cell carcinoma from the wounds or scar of the skin is called
Marjolin.
Marjolin ulcer. Which squamous cell carcinoma precursor that is seen more common in individuals exposed to sunlight like farmers?
Small.
Actinic keratosis.
Actinic keratosis. Right? Actinic keratosis or solar keratosis under increase in risk of progression to squamous cell carcinoma. Telangiectasia, rolling borders,
Basal cell.
basal cell carcinoma involves lower or upper lip?
Lower.
Upper lip. Squamous cell carcinoma involves
Lower.
lower lip. Reticular white lines. Reticular white lines.
Wickham
striae that is seen with
lichen planus.
lichen planus. Excellent. Yes, lichen planus. Herald patch appearance. Christmas tree distribution.
Malici-
Meriasis. Rosea.
Yes,
Rosea. Remember, oval shaped or scaly appearance, scaly rim around the edges. Classic NBME question. This is tested in NBME. This is important, right? Decubitus ulcer. What is the important cause? Decubitus ulcer.
Pressure.
Pressure. The pressure injury. Decubitus ulcer is pressure injury, whereas vesicles-like lesions that are seen on the skin in a patient who is having celiac disease.
Hepatitis
Hepatitis herpetiformis, drug of choice. D for dermatitis herpetiformis, D for dapsone.
And glutein.
Mechanism of action of dapsone.
Mechanism of action.
Inhibits
Dihydropteroate synthetic.
Oxidate synthesis.
Just like
Leflunomide and
No.
Yes.
Just like
Sulfonamides.
sulfonamides, isn't it? Which hematological complications they can have if a patient is given dapsone?
Hemolytic anemia.
Hemolysis in G6PD deficiency. What else?
And
This was also seen
Methemoglobinemia.
taking bupivacaine. Yes, we have an anesthesia. Methemoglobinemia. Methemoglobinemia, right? Methemoglobinemia is iron in which state? 2 plus or 3 plus?
3.
3 plus. Reduction occurred with the help of NADH. NADH. Whereas methylene blue utilizes what to convert iron from Fe3 plus to 2 plus? NAD. Yes, that's why I told you if you give a patient with G6PD deficiency, blue, not gonna help. That's why you have to give them vitamin C. Vitamin C. For vitamin C, that's why you give individuals with iron deficiency anemia, you give them orange juice. Reason? Converts iron from Fe3 plus to 2 plus form, which is the absorbable form of iron in the duodenum that is transported with the help of divalent metal transporter, isn't it? Which particular transporter picks the iron from the intestinal cells and brings it into the blood?
Ferroportin.
Ferroportin, exactly. This ferroportin transport
transports.
is blocked by. Listen to the question very carefully. Ferroportin transport.
Hepcidin.
Hepcidin also blocks which other particular component so that iron is not
Transferrin.
From macrophages.
from the liver and bone marrow macrophages. So it increase or decrease the stored form of iron.
Increases.
Increase.
Reticuloendothelial system. Reticuloendothelial system. Classic scenario of anemia of chronic disease. Of chronic disease, right? Reticuloendothelial system stored hepcidin, negative iron regulatory protein. It is elevated if the patient is having chronic diseases or infections. Classic questions, patients with autoimmune diseases such as SLE, right? Or individuals with infectious conditions, chronic pneumonia patients or patients with bronchiectasis, right? Important. So hepcidin's role, right? I told you ferroportin was transporting and then the iron is again binding. I told you hepcidin converts it back, but it binds to transferrin the iron in Fe3+ state. Iron depositing surrounding the mitochondria. Ring the
Sideroblastic.
sideroblast. Iron surrounding the mitochondria. No formation of protoporphyrin, isn't it? Right. Hepatitis C was associated with which particular porphyria?
PCD.
Yes, porphyria cutánea tarda. Urine? Color urine. Port wine color urine was for acute intermittent porphyria.
Acute intermittent.
Right. Port wine stain was for George-Weber syndrome.
Yes.
Hypoxia inducible factor 1A.
I consider this by so. Oh, wait, sir. The one at night.
On
The one at night.
Hippolyndo, mode of inheritance.
VHL, autosomal dominant.
Autosomal recessive.
Autosomal dominant. Which particular cancers? Which particular other
Or
cancer? Renal cell
renal
carcinoma is derived from proximal tubule.
proximal
Proximal tubule syndrome. Proximal tubule syndrome.
Fanconi.
Kinase is RTA.
RTA
type.
RTA type
Three.
Type
2.
Type 2. Right. Inability to secrete hydrogen ions, alpha intercalated cells. Which RTA? Type 1. Which RTA was associated with AC inhibitors, ARBs?
3.
Type 4.
Four.
Type 4 is hypoaldosteronism. We only studied 1, 2, 4, no 3.
Yeah, there's no
Right?
one to
Hypo is aldo, right? Hypoaldosteronism. Type 4, which was associated with low aldosterone, ACE inhibitors, ARBs, aldosterone antagonistic drugs, all were associated with type
4.
RTA. Amphotericin B or autoimmune diseases. Which
One.
one. Type 1. Mode of inheritance for Liddle syndrome.
Dominant.
Liddle has double D.
Yes.
Liddle has double D. Right?
Yes,
What type
yes.
of mutation? Liddle syndrome.
alpha nucleotide.
Ina.
No.
ACT gene. What is ACT?
ENaC.
Inhibiting
Gain of function ENaC.
ENaC. Mutation. What are the drugs that block that ENaC channels?
Aldosterone.
Triamterene and amiloride. Right. That's why the drug that can be given in patients with Liddle syndrome is
Amiloride.
amiloride. Triamterene. Which other drug that blocks ENaC channels also? Trimethoprim. Trimethoprim. Right. Trimethoprim. We study it inhibits which particular step?
Or the
Folate.
folate. Yes, folate.
Right.
Same.
Trimethoprim plus sulfamethoxazole. Cotrimoxazole. Drug of choice in which condition we study?
Pneumocystis.
GSV2.
Nocardia.
Nocardia.
UTIs.
UTIs.
TMPSMX, right? Trimethoprim, sulfamethoxazole, right? Just like that, pyrimethamine and sulfadiazine, drug of choice,
TMPS.
toxoplasma.
Toxoplasma.
Toxoplasma CD4 count less than
100.
100. Drug of choice for neurocystic sarcosis.
Albendazole.
Albendazole. Whereas teniasis,
Praziquantel.
quantum mechanism of action.
Increases calcium permeability.
Calcium permeability. What is the mechanism of action of chloroquine?
Chloroquine.
Inclusion oxygenase. Right? Chloroquine was also studied about this. Can be used for
Imozone.
rheumatoid arthritis. Right?
Yes.
And that was a drug that we studied was claimed speech mnemonic, but L was for leflunomide inhibitor enzyme.
PPR.
PPR. Amidod. No.
And
Dihydroorate, dehydrogenase, pyrimidine synthesis pathway.
DHBS, yes.
Dihydroorotate, dehydrogenase, leflunomide inhibits it. Remember the drugs were anakinra, infliximab, abatacept, all the drugs which were given? Methotrexate was one of the most important one. Inhibits the enzyme.
Dihydrofolate.
Reductase. What are the adverse effects of methotrexate? Tell me at least two, other than bone marrow suppression and low folate.
Yeah.
Photosensitivity.
Yeah, anti-cancer medications, regular adverse effect and what?
Hepatotoxicity,
And
pulmonary
myeloid
fibrosis,
suppression.
Those are common. Yes, pulmonary fibrosis. Any other?
Myelosuppression.
teratogenic,
Yes, it is teratogenic. Yes, but
mucositis.
mucositis, oral mucosal ulcers. So I told you M for methotrexate, M for mucosal ulcers. Another M I will tell you, M for metronidazole, M for metallic taste. Remember this.
Yeah.
M for metronidazole, M for metallic taste, M for methotrexate, M for oral mucosal ulcers. Important. Methotrexate also for ectopic pregnancy that we discussed about this, right? If somebody is weaning off from steroids, yeah, somebody is weaning off from the steroids, which particular anti-cancer drug we can give that can help for weaning off from steroids?
I know this.
Azathioprine.
Azithromycin.
Azathioprine.
Yeah,
Right? Remember the interactions of azathioprine with which drug?
yeah. 6 mercaptavir.
Which drug interaction? Allopurinol.
Allopurinol.
Allopurinol inhibits xanthine.
Xanthine
Which other drug
oxidase.
inhibits xanthine oxidase?
Febuxostat.
Febuxostat. Which particular drug breaks down? That is breaking down uric acid.
Raspberry.
Or uracil.
Pegloticase.
Pegloticase, which is long-acting pegylated, means long-acting. Pegloticase, pegylated, long LO. Pegloticase is a uricase enzyme that is going to be long-acting. Which particular drug was a uricosuric drug that has interactions with penicillins and cephalosporins?
Probenecid.
Probenecid. Can you recall any other hematological adverse effect of probenecid?
We can leukemia.
Uric acid.
CSF pain. CSF pain.
Yes.
Small intestine. G6PD.
G6PD.
P was for probenecid. P was for pyrimethamine. Thymoquine. 3 P's were there, right? So in that, probenecid was a uricosuric drug. Again, contraindicated in patients with uric acid stones, right? Uric acid stones. Which urinary stones forms at high pH?
Again.
High pH renal stones.
Yeah, please, bro.
Normal.
Calcium phosphate and ammonium phosphate. Calcium phosphate and ammonium phosphate.
Yes,
There is a name that has high pH. Calcium phosphate and ammonium magnesium phosphate stones, they form at high pH. 16 stones, low pH. What is the test that we were doing for the 16 stones?
For
Cyanide nitroproside test. Cyanide nitroproside test, isn't it? Right? That turns it into blue color, isn't it? Right. Cyanide binds to cyanide is binding to iron in which state? Fe2 plus or 3 plus?
3 plus.
Carbon monoxide
3
plus. Which particular step in electron transport chain is inhibited by cyanide and carbon monoxide?
4.
3.
Next 4. Cytochrome oxidase. Cytochrome oxidase. Metformin.
1.
1. Barbiturates proteinone.
1.
1.
What are the uncouplers?
1.
Thermogenin, 2,4-dinitrophenol. But thermogenin, where it is present? Most abundant.
Brown fat.
Brown fat. What is the function? Producing heat.
Produces heat.
Heat. Yes, yes. Which particular hypothalamic nucleus is a heating center?
Hypothalamic.
Posterior. Whereas anterior is
Cooling center.
cooling center. Which sensory nucleus in the thalamus was taking care of sensations from the face?
VM.
Makeup.
Makeup.
BPM.
Yeah,
BPM. Right? Whereas for the limbs was? VPL. And for the limbs. And for the makeup. Isn't it? Right. Whereas the sensory nucleus for the hearing was which particular body? Medial geniculate body receives the input from
Inferior
follicular